The vertebral column of rabbit has 45 to 47 vertebrae in total. We can classify them into 5 regions, that is cervical region, that is the neck region, which has 7 vertebrae, the thoracic region, which has about 12 to 13, the lumbar, the main portion, which has 7, and this is the sacral part, that is the fused part of this vertebra, which is attached to the limb, hind limb region, that is the sacral, which is about 4 fused vertebrae, and the caudal or the tail vertebrae is 15 to 18. So there are total, that is why it is written as 45 to 47. It can range from, that is, the range is from 45 to 47. Cervical, it won't change, it is always 7. Thoracic can be about 12 to 13 in some. In lumbar, that is only 7. While sacral, it is also fixed, it is only 4. The caudal can change. It can be either 15 or 16 or 18. So, this is the vertebral column. Now, whenever we discuss about vertebral column, we talk about the vertebra in general. So, we select one of them which is quite large in size as the typical vertebra. So, it will be easy to study the others in relation to this. So, in typical vertebra, we select a larger vertebrae which is having all the parts well developed. That is what is meant by a typical vertebra. In rabbit, it is the lumbar vertebra. That is the, if you don't remember that, this is the lumbar region. Okay. So this type of vertebra, these are all single pieces. So this is very well developed in a rabbit. So we take that as the typical vertebrae of a rabbit. And when we observe the typical vertebra, we have the main important parts of any vertebrae is the centrum. This is the centrum. This is the neural arch, then neural canal and neural spine. Then there is the transverse processes. അപ്പോൾ ഇതിൽ സെൻട്രം എന്ന് പറയുന്നത് പല വിധത്തിലുള്ള സെൻട്രം ഉണ്ട്. ഒന്ന് AC-ലെസ് സെൻട്രമാണ് നമുക്ക് പഠിക്കാനുള്ളൂ. എന്ന് വെച്ചാൽ ഇതിൻ്റെ ആൻറ്റീരിയർ പോർഷനും പോസ്റ്റീരിയർ പോർഷനും ഫ്ലാറ്റ് ആയിരിക്കും. ചില ഇതിൽ കോൺകേവും കോൺവെക്സും ഒക്കെ ആയിട്ടുള്ള ഭാഗങ്ങളൊക്കെ ഉണ്ട്. അപ്പൊ ഇതില് സെൻട്രം രണ്ട് സൈഡും ഫ്ലാറ്റ് ആയിട്ട് കാണുന്നതായതുകൊണ്ട് അതിനെ AC-ലെസ് സെൻട്രം എന്നാ പറയാം. ഇതിന്റെ തൊട്ട് മുകളിലായിട്ടൊരു കനാല് ഉണ്ട്. ആ കനാൽ എന്ന് പറയുന്നത് ഈ വെർട്ടിബ്രൽ കോളം എന്തിനാണ്? സ്പൈനൽ കോഡിനെ പ്രൊട്ടക്ട് ചെയ്യാനാണ്. അപ്പോൾ ബ്രെയിനിൽ നിന്ന് വരുന്ന സ്പൈനൽ കോഡിനെ പ്രൊട്ടക്ട് ചെയ്യുന്ന ഒരു സ്കെലിറ്റൽ സിസ്റ്റം ആണ് നമ്മുടെ വെർട്ടിബ്ര എന്ന് പറയുന്നത്. അപ്പോൾ പിന്നെ ആവശ്യമുള്ളത് എന്താന്ന് വെച്ചാൽ ഇതിന്റെ ട്രാൻസ്വേഴ്സ് പ്രോസസ്സസ്. ഇത് മസിൽ അറ്റാച്ച്മെന്റ്സിന് വേണ്ടിയിട്ടാണ്. ഈ സൈഗാപ്പോഫൈസസും പ്രീ സൈഗാപ്പോഫൈസസ് എന്നൊക്കെ പറഞ്ഞിട്ടുള്ള ഭാഗങ്ങൾ എന്ന് പറഞ്ഞാൽ അടുത്ത് കിടക്കുന്ന വെർട്ടിബ്രകളെ ആയിട്ട് യോജിച്ച് ഇരിക്കാൻ വേണ്ടിയിട്ടുള്ള പ്രോസസ്സ്. അപ്പൊ ഇതാണ് കോമൺ ആയിട്ട് എല്ലാ വെർട്ടിബ്രയിലും ഉണ്ടാകുന്നത്. സെൻട്രം, ന്യൂറൽ കനാൽ, ന്യൂറൽ ആർച്ച്, ന്യൂറൽ സ്പൈൻ. ന്യൂറൽ സ്പൈൻ എന്ന് പറയുന്നതും മസിൽസിനെ അറ്റാച്ച് ചെയ്യാൻ വേണ്ടിയിട്ടുള്ള പോർഷനാണ്. അപ്പൊ ഈ ട്രാൻസ്വേഴ്സ് പ്രോസസ് ആയാലും ഈ ഇതൊക്കെ മസിൽ അറ്റാച്ച്മെന്റിന് വേണ്ടിയിട്ടാണ്, സ്പൈനും ട്രാൻസ്വേഴ്സ് പ്രോസസ്. ഇത് ഈ ന്യൂറൽ കനാൽ എന്ന് പറയുന്നത് സ്പൈനൽ കോഡിന് പാസ് ചെയ്യാനുള്ളതാണ്. ഇതല്ലാതെ ചെറിയ ഫൊറാമെൻസ് ഒക്കെ ഈ ഭാഗങ്ങളിലായിട്ട് കാണാം. രണ്ട് വെർട്ടിബ്ര ജോയിൻ ചെയ്യുന്ന ഭാഗങ്ങളിൽ ചെറിയ ഫൊറാമെൻസ് അല്ലെങ്കിൽ ഓപ്പണിങ്സ് ഉണ്ടാവും. അത് ഈ സ്പൈനൽ നെർവ്സിനും ബ്ലഡ് വെസൽസിനും ഒക്കെ പാസ് ചെയ്യാനുള്ള ഭാഗങ്ങളാണ്. So the main parts of the typical vertebra include neural spine, neural arch, neural canal, centrum, the transverse processes, the pre-zygapophysis, the meta-zygapophysis, and the hypophysis. So these all are the parts of the typical vertebra, which is the lumbar vertebra in rabbits. Now let us look at the typical vertebra again. A simple plan of the vertebra. It has a centrum, then the neural arch, neural canal, neural spine, transverse processes. Here the zygapophysis is not shown in the diagram, but there is zygapophysis which help in the articulation with the adjacent vertebrae. Here the different functions of the parts are given. Neural canal helps in the passage of the spinal cord. Neural arch surrounds the neural canal. Neural spine projects dorsally. It helps in attachment to the muscle. Centrum, it is ventrally located and fits into the intervertebral disc on both sides. This helps. This centrum is the that it has the cartilage intervertebral disc which helps as a shock absorber. Transverse processes are seen on either sides which helps in attachment to muscles. Zygapophysis is articulation with the adjacent vertebrae. The cervical vertebra, which is the first part of the vertebral column, it has 7 vertebrae. The first and the second are called very important because they are very distinct in shape. The first one is called atlas, the second is called axis. The remaining 3 to 7 are similar in structure. So this is the structure of the atlas. It is like a ring. So it has the centrum which is very reduced. The neural spine is very reduced. The transverse processes are flattened. So this is how it looks like. The neural canal is very large, or it's comparatively a much larger opening. The neural spine is very small. The neural arch is also present. Then there is a facet for the odontoid process. Facet for odontoid process means this is the first vertebra. Second vertebra is an axis vertebra. Axis vertebra is an odontoid process. That odontoid process comes and joins to this facet. So that helps in the movement of the neck. That is why it is very important. This is the neural spine, and this is the neural canal, vertebral canal. This is anterior view of that atlas vertebra where the facets can be easily it is enlarged. So this is clearly seen here, the facets for occipital condyle. This is for facet for occipital condyle, means that is for the attachment of the skull. So this is the facet for the axis vertebrae to attach. This is the facet for the skull to attach, that is the occipital condyle. So that is how it is. Next is the axis vertebrae, that is the second vertebrae of rabbit. The second vertebrae of rabbit is quite distinct, has some distinct characters from that of typical vertebrae and the atlas vertebrae. The axis has a broad centrum. Okay, and it has a peg-like process. Look at this one. Forward process called odontoid process. Some of the features you may not observe in this diagram. So this is the odontoid process. It is the odontoid process that articulates at the facet of the atlas. The atlanto-odontoid articulation helps in the rotation of the head. So this odontoid process, when it articulates with the atlas, it will help in rotation of the head. The neural spine, it is quite long and compressed. The neural spine is long and compressed. The transverse processes are short. And now when we look at the atlas vertebra, this is seen here. Its neural canal is divided into two by a ligamentum transversum. This is the ligamentum transversum which divides the or partitions the neural canal into an upper spinal canal and the lower odontoid canal. It is to this region that this odontoid process will come and articulate. So this helps in the rotation of the head region. Now the spinal canal helps in the passage of the spinal cord through it. And the ligament that separates it's called ligamentum transversum. So the axis has a broad segment. It has a peg-like odontoid process. It has the long spinal projection of the neural spine. Then it is long and compressed. The transverse processes are backwardly directed, and there are vertebral foramens which is helping in the passage of the spinal nerves and arteries at the base, at their base. The small openings, they help in vertebral openings which helps in the passage of the spinal nerves and arteries. Now the next one is these are the cervical vertebrae. The rest of the cervical vertebrae have a common shape of having a centrum, neural canal, neural arch, neural spine, pre-zygapophysis, transverse processes, etc. Now this is a typical structure of the cervical vertebrae. Now that has a broad neural arch for protection of the spinal cord. It has forked and short transverse processes for the attachment of neck muscles. Atlas has broad surfaces for articulation with the occipital condyle of the skull to permit the nodding movement of the skull. The vertebral canal help in the passage of neck, blood vessels and nerves. Axis has an odontoid process and a projection of the centrum to permit rotator movement of the skull. The odontoid process acts as a pivot joint for the atlas and skull. The short neural spine helps in the attachment of neck muscles. The wide neural canal helps in the passage of the enlarged spinal cord. The thoracic vertebrae is around 12 to 13 in number. They are very similar to the typical vertebra but without mammillary processes. Mammillary processes are the metapophysis. So, in them, the neural spine will be very elongated. That is what is shown here. The long neural spine. And it is, each thoracic vertebra has a pair of double-headed ribs attached to it. For articulation for the ribs, it has two facets. That is the tubercular facet and the capitular facet. Tubercular facet helps in the attachment of the tuberculum and capitulum attaches to the capitular facet. Other features include it has a large centrum, large neural canal, pre-zygapophysis, post-zygapophysis and neural canal. As in all the typical vertebra, all these features are present, but the distinguishing feature is that it has short transverse process, long neural spine and tubercular and capitular facet. This is the typical thoracic vertebra. മറ്റുള്ള vertebrae ഒക്കെ നോക്കുമ്പം ഇതിൽ കൂടുതലായിട്ടും കാണുന്നത് ചെറിയ transverse processഉം broad sternum, large neural canal, long neural spine. ഇതാണ് ഇവിടെ വ്യത്യാസം. Neural arch for the protection of the spinal cord, centrum for the attachment of the transverse process, pre-post zygapophysis for attachment to the next vertebra, tubercular and capitular facets for the attachment of the ribs, reduced transverse process for the attachment of muscles, long neural spine for the attachment of back muscles. ഇതാണ് ഇതിന്റെ distinguishing features. Next slide we will learn about the lumbar vertebrae.